Hi, we are at the final stretch of our conference today, and I'd like to thank you all so much for joining us. And wow, the Fantastic Four. Wow, they coordinated. I'm really impressed. So we heard a lot from many fantastic speakers today, beginning with our administrator, Chiquita Brooks-LaSure, setting the tone. And truly, I'd like to thank each and every one of you who have been with us throughout the day, who have been with us online. We have well over 1,000 participants that have been online with us throughout the day. It's been wonderful to be here on the Howard University campus, and I'm glad that we were joined by Dr. Hayes Dixon, the Dean of Howard University's College of Medicine. She spoke to the importance of representation in health equity, which we echo in our CMS framework, which emphasizes the importance of supporting the healthcare workforce and highlights the vital role providers and healthcare workers play. I'm glad to say that we'll hear more from Howard University tomorrow when we're joined by Howard grad student Jelani Williams, who will speak further about the importance of giving back to community. We were also fortunate to be joined by the Assistant Secretary of Health, Admiral Levine, this morning, who gave such a powerful speech and highlighted the key areas of importance for health equity, like climate change, LGBTQI+ health, sickle cell disease, and long COVID. All areas we can address that access to care and other barriers to move forward in achieving health equity. We heard from Mr. Benjamin Smith from the Indian Health Service. He highlighted the importance of acknowledging historical injustices in the social determinants of health, emphasizing the need to partner with diverse communities and different types of organizations to address health disparities. Community connections and partnerships were a theme across the board of our speakers today as we look to access care. We know these are essential parts of understanding and addressing health disparities and progressing towards health equity. This morning, we were also fortunate to be joined by Mayor Stephen Benjamin, the Senior Advisor and Director of the Office of Public Engagement at the White House. He told us about the White House challenge to end hunger and build healthy communities. The challenge asked stakeholders to make commitments to end hunger and increase healthy eating and physical activity by 2030, so fewer Americans experience diet-related diseases, all while reducing disparities. If you want to get your community involved, we encourage you to fill out the interest form. For those who are joining us virtually, we are listing the link in the Zoom events chat. And for those in the room, please visit health.gov for the White House Hunger, Nutrition, and Health. Our conference is focused on framing the future of health equity. We at CMS are encouraging you to join us in implementing the CMS Health Equity Framework and its 5 priority areas. So focusing on area 1 and the work to expand data collection, reporting, and analysis of standardized data, we heard a lot about LGBTQI+ populations and how to improve SOGI data collection. In another session, we learned about the Social Vulnerability Index tool developed by HHS to identify communities in need for focused, data-driven public health interventions and initiatives. Looking to our second priority area to assess causes of disparities within CMS programs and address inequities in policies and operations to close gaps. Another session discussed oral health and addressing disparities across the lifespan. We also heard from many colleagues about the advances across Medicare and the CMS Innovation Center. Focus on supporting our workforce in priority 3, we heard about the important work happening at federally qualified health centers, and of course, the impact of COVID-19, which we all know too well. We also heard about the move from crisis to equity in handling COVID-19, and now the important work that's happening across the country related to Medicaid unwinding. This was just to name a few of the exciting conversations and sessions we had today. And aside from the excellent panels, we heard from our federal partner showcase and poster hall offering even more information and covering the priority area 4 and 5 topics of health literacy, health equity, and accessibility. We'll hear from each of these topics and priority areas tomorrow as well. And if you're participating online, be sure to check out the poster hall information on the virtual form, on the virtual platform too. This morning, Administrator Brooks-LaSure gave us all a clear call to action to get involved and think about how you can help CMS implement the health equity framework in your work. We have to look back to look forward. So today and a little tomorrow, we'll hear about where we've come from and what we know now to inform our movement forward. I am so excited for our speakers that will be joining us tomorrow. We have health equity leaders. Well, I'll start by saying health equity leaders of the past have brought us here. But we have new leaders that are emerging as well, like people in the room and joining us online. And the baton has been passed to each of us. So tomorrow, our lens will focus on the future of health equity. Our day will begin with Dr. Daniel Doss and Dr. Brian Smedley, providing insights into the imminent needs across the healthcare system and how to diffuse a culture of health equity. Day 2 includes additional poster presentations and the continuation of the Federal Partner Showcase. And if you were excited about today, expect to be knocked off your feet tomorrow. So Day 2 presenters, I'm setting a high bar for you. We will have about 50 presenters tomorrow. I think it's actually more than that. We're going to have a lot of presenters in our breakouts tomorrow, so very rich discussion and information. So with that, I'll just briefly share. Some of the breakout sessions will cover artificial intelligence and innovative technologies, amplification of lived experience and community partnerships, health literacy and language access, transforming tribal health, the Medicare value-based strategy, and people with disabilities, living with disabilities. I'd like to highlight a particular breakout session that focuses on an area of health that minority and underserved communities are faced with, and that's diabetes. So diabetes is a vital and growing threat for people, for the people that CMS serves, and about 3 out of 4 Americans ages 65 and older have either pre-diabetes or diabetes, and significant racial and ethnic disparities exist in prevalence of diabetes. As announced at the recent White House Conference on Hunger, Nutrition, and Health, CMS has been developing a strategy focusing on reducing the burden of illness from diabetes. And it has been an honor for me to help lead this effort for CMS, given the work that I've been able to do over the years to help people with diabetes. So I'm pleased to invite you to learn more about this developing strategy related to intervention research at the breakout session tomorrow, June 8th, entitled Health Equity and Diabetes Prevention and Care from 10:45 to 11:45. With that, this concludes the first day of the CMS Inaugural Health Equity Conference. Thank you to all of you. Thank you. We are so honored that you spent your time with us today. And again, we look forward to it tomorrow. We have through the rest of the hour for networking. I encourage you to go out and see the posters, to visit our federal partners, but we cannot do this work alone. So thank you.